Hi, welcome back to True Wellness. Thanks for checking out our video vlogs. Today we're going to talk about one of the most important aspects in biological medicine, and the thing that really separates biological medicine and what Dr. Rao calls foundational medicine from all other aspects of therapies. And that is marrying the dental component into our health care. And I know that most folks go to the dentist and we're told to take care of our teeth and brush our teeth and floss our teeth and make sure that our teeth are healthy. The difference is that in biological medicine there is an understanding that every single tooth actually relates to and is connected to an acupuncture meridian that has an energy flow to it, that also then relates to an organ or organ systems that are related to that meridian. And so ultimately our teeth are very important and very connected to all the systems, organs, meridians, joints, and senses of the body. So whatever is done to our teeth is affecting our organs, our bones, our joints, our structure, and our emotions as well. So we really can't disconnect our teeth from the health of the rest of our body. And it's really interesting, over a couple of hundred years, there's been this very specialized aspect of health, which is dentistry. And dentists are very important. They're so important because whatever they do to our teeth affects the rest of our body. And some dentists, biological dentists, are very aware of this. Other dentists aren't necessarily as aware of the connection that the teeth have to the rest of the body. So for us, when we're dealing with biological medicine, helping people with their health and trying to restore their health and maintain their health as best as we possibly can, and really allow as little stress as possible on the nervous system and on our immune system, dealing with a biological dentist is one of the most important things we can do. And there's really only a handful of biological dentists in the United States that I'm aware of that I'm comfortable referring people to. So if you're interested in making the leap and having someone that's trained in biological dentistry look at your teeth and help you with your dental health, please give the office a call. We'd be happy to refer you to someone that's close to your area if that's possible. And like I said, there's only a handful really in the United States. For a very long time, we were actually sending people from here in Pennsylvania all the way to Santa Fe, New Mexico to have their teeth handled biologically, and then coming back and continuing therapies with us. Today there are a few dentists in our area that are absolutely biological that we're comfortable with. So if that's something you're interested in and something you know you need, please call the office 267-308-0777 and we'll be happy to give you a referral. Outside of the stressors that teeth have when it comes to amalgam fillings, the amalgam filling is actually the stressor on the body. Of course, a infection or a root canal or the need of a filling is going to be important to have handled appropriately. And it's important to realize that once the amalgams, we all know amalgam is bad for us because that's leaking into the body and that's causing a different type of stressor than just a stress on the tooth. So for most folks that are dealing with biological therapy and medicine, they understand that amalgam fillings are very detrimental to the system. We help people handle that with good biological dentistry. We're talking about today more of the stress on teeth from other procedures being done, things like root canals. When a root canal is done, it's virtually creating a dead tooth. If I drill the roots out of a tooth, we disconnect it from the body on some level. That tooth no longer has respiration, doesn't have blood flow, and it's really disconnected from the body. When that happens, the immune system kicks in and looks at that and says, hey, I've got a dead tooth here, I want to try and get rid of it. And I've asked several dentists in the past, what's the final outcome of a root canal tooth? What eventually happens? And every single one of them has said the same thing to me. Well, eventually the tooth needs to be pulled out because usually there's some kind of abscess that eventually shows up. Or the body actually kicks it out and the tooth falls out on its own. That's usually what happens to a root canal tooth. How long that takes? Who knows? Maybe 5 years, 10 years, 15 years. But eventually root canal teeth are pulled usually, because the body just can't tolerate dead material. Now, the fact that that tooth has been destroyed on some level but left in the body really affects that energy flow that we were talking about and the meridians. It also encapsulates infection because it's very difficult to take the tubulars that are in teeth, which are about 5 miles long, depending on the tooth, and fill that full of material where all the bacteria is actually killed. If all the bacteria is not killed in that root canal tooth, and then it is capped, that bacteria has nowhere to go. The nervous system and the immune system can't get to it as well, and it just festers as an infection, a dental foci, that causes distal problems in the body. So root canals are a real problem for folks. We feel it's a big stressor on people. The amalgams, of course, are a big stressor. Wisdom teeth that are impacted are a huge stressor on the body. Because a wisdom tooth that's impacted is laying down and it's generally pushing against, it's trying to grow, but it's not coming through the gum, so it's pushing against my other teeth, and my other teeth start to shift because of it. And when I put a bunch of stress on the other teeth, each one of those teeth having a relationship to the organs and meridians of my body start to stress those areas. So the brilliance that Dr. Rao had and other practitioners in regards to biological medicine to include, and not just include, but make the dental component a very important and primary aspect of biological medicine has been a tremendous breakthrough. We've been able to help more people recover from what looks like devastating illnesses and diseases just because we helped that aspect as well as other things, but really handling that dental component and making sure that one of the big stressors that the body is under was not one of the dental components. Alleviating that stress allows the nervous system and the immune system to really focus in on the other things that are causing a problem for us. So we went through those classes a long time ago. I think we graduated in 2008 with Dr. Rao from his classes, and we continue to go to class with him as well as other doctors in biological medicine. And the dental component is something that we just can't focus on enough with folks. And it's important today that we spend some time with you and get you to realize that, you know, a lot of times when people come in, quite honestly, one of the biggest stresses that they're under is things that have been done to their teeth over a long period of time in their life. Because if you think about it, for a lot of us, the first amalgam filling probably happened when we were 12 or 13 or 14 years old. And I've seen some folks that have old amalgam fillings and root canals and twisted teeth that are 30 and 40 years old that have been there that long. So ultimately, when we're up against trying to maintain or restore our health or really deal with an illness that's present day, making sure that the dental component is not one of those stressors is one of the greatest things we can do for folks. So again, if you're interested, and I hope you are, because the dental component is something that we just can't overlook. And I know that for a lot of folks, the last thing they want to do is go sit in a dental chair because they have migraine headaches, or they have numbness, or they have digestive problems, or they have foggy brain, or name any group of different illnesses that really show up for folks. One of the first things that biological practitioners are going to look at is the condition of your teeth. Just like all the pet owners out there, if you have a dog or a cat and you take the dog or a cat to a vet, the first thing that vet typically does is look at the animal's teeth. Because the vet knows that through those teeth, I can determine what's going on with a lot of symptoms and reactions that the body's having in regards to this animal. I can tell the health of this animal by the quality of the teeth and the situation that the teeth are in. Well, human beings are no different. You can really look inside the oral cavity and get a good idea of what's going on digestively and where the stresses are in regards to their teeth. So again, if you're interested in hooking up with a good biological dentist, please give us a call. We'd be happy to refer you to a good biological dentist, 267-308-0777. And at the end of those classes in 2008, after those 2 years and then doing an internship at the clinic, I remember Dr. Rao standing up in front of the class and he said, you know, if I was on a desert island and I could only choose one doctor to ever really help me with my health, I would want a biological dentist. And at the time, even though we had gone through the classes, I found that interesting and a little strange. But quite honestly, after all the years of doing this and helping as many people as we can and looking into a lot of mouths and looking at a lot of teeth, I would say the same thing. If I was stuck on a desert island and could have only one practitioner to ever help me with my health, I would absolutely want a biological dentist that knows how to influence my teeth, to influence my organs and my meridians to really keep me healthy. So I hope today we raised some questions for you and you think about what dentists are doing out there and how critical they are, and what they do to our teeth affects our whole system and our body and our health. So again, it's good to talk to you, and we hope to see you soon. And thanks for checking in on our video blogs. Take care of your teeth, and we'll see you soon.